presented by Policy Bazaar.
CNBC TV 80, the Policy Bazaar Insurance Show.
From the beginning of this special insurance series with Policy Bazaar, we've had a special focus on India's health insurance setup, the right awareness, suitable policy, adequate coverage, and effective claims. Today, we unfold a new edition, currently nascent but promises to cover the country's healthcare expenses in a big way going forward. Inclusion of Ayush treatments through health insurance. To discuss what kind of treatments get included under Ayush, the scope, the size of these treatments, and can your health insurance policy cover all of them for you, we are joined by Mayank Bathwal, the Managing Director and CEO at Aditya Birla Health Insurance, Amit Chabra, the Chief Business Officer General Insurance at Policy Bazaar, Siddharth Dominic, the CEO at CGH Earth Wellness, and Thomas Devasya, the former member non-life at the Insurance Regulatory and Development Authority of India. For Thomas Devasya, until very recently, he was the member non-life with IRDAI. More relevant is that he's acknowledged as a technical expert and a client advisor in general insurance, reinsurance, including health. He's also developed and underwritten bespoke group health programs that embedded features that are today referred as wellness. Thank you, gentlemen, for joining us today for this discussion on a very, very interesting topic, that is, how to put this missing piece of the puzzle of insurance into the scheme of Ayush treatments. Thank you so much. To start with you, Siddharth, as a conversation starter, 46% of rural and 53% of urban individuals availed Ayush treatments, and these numbers and the data are provided by MOSPI. In fact, another interesting data point would be that 95% of the people in the country today are aware of Ayush treatments. So though it would be new in the context of insurance, but the term Ayush and the treatments there are not new to Indian population. But for people who've not heard this concept, break it down for us. What are the treatments that get included as far as the umbrella of Ayush treatments are concerned? And second thing, you've been running a wellness center. Over the last couple of years, what has been the approach from people? Are they inquiring about these treatments? How has the adaptability gone up as far as these treatments are concerned?
Yeah, thank you, Yash. I think I'd like to begin just to say that we as CGH Earth Wellness, we've been in the business of offering Ayurveda, holistic Ayurveda for the last 22 years. And we've seen a world of change over the last 20 years. When we started, it was an international audience we were catering to. But over the post-COVID, we have seen a huge increase, a 50% increase in the number of Indians who have been seeking alternative treatment, traditional sciences. So when you ask me the question, what do you mean by Ayush? I think it's all those sciences are the knowledge that resides in India, from Ayurveda, Yoga, Unani to Siddha, and naturopathy, homeopathy, and all those sciences. So suddenly the world is taking recognition of these sciences and seeing the wonders that it can do to lifestyle conditions, lifestyle issues. And there is much more awareness of one's health today in a post-COVID era. And this is really reflecting in the kind of population of people who are inquiring with us for our kind of products.
Mayank, with that, the other side of responsibility also comes on insurers like yours. The regulator recently also spoke about how insurance companies as an advisory should include Ayush treatments. Let's just understand the structure of any health insurance policy today. For new policies, for existing policies, does it get embedded in the policy even if it's an old policy? And for new policies, do people have to seek a rider, or does it come with the policy? If you can help us understand that.
I agree that, I think Ayush is clearly becoming a very, important part of the mainstream healthcare, service delivery. And I think in that context, now all health insurance products cover Ayush treatments as well. So there's, as the question that you asked, whether it's only old or new, no. Whether it is existing products, whether it's new products, all of those products cover the Ayush benefits across the entire spectrum of Ayush, as Siddharth just elucidated. One thing that we have to keep in mind is that traditionally the health insurance products in India have generally catered to inpatient expenses. So if you're in the hospitalization expenses, the effort and work on bringing in outpatient expenses into the insurance stream is still work in progress. I mean, we have made some progress across the industry. We ourselves, as at Aditya Health Insurance, do a lot of that, at least in the corporate space now. In the retail, we are working because of various reasons. And to that extent, Ayush, whilst inpatient treatment will be covered 100%, outpatient will be restricted to where the existing product caters to outpatient generally.
Mr. Devasi, I want to come to you with a question. Of course, as I started, asking Mayank also, the regulator from its part has sent out an advisory to insurance companies to look at the coverage here. In your understanding, what more should be done from the regulator's end to ensure that the advisory is followed up and taken up by the industry in a meaningful and a significant way ahead?
Indeed, the advisory that you allude to would be the one that was issued sometime in January 2023, making effective 1st April all Ayush coverage. But there are certain regulatory interlocks that are created by the IRDA, typical of any other regulator. So it also there was regulations on policyholder protection, where one of the stated objectives was that the insurers should ensure policyholder-centric governance. In ordinary language, it means that you should operate with fairness and to certain ethical standards. Then that was reinforced with even regulations on corporate governance, which required board-level, monitored, board-driven committees and subcommittees that are going to look at product construct, product take-up, policyholder service levels, how grievances are redressed. So it is not just that we issue, or the IRDA issues a regulatory advisory and then sits back. Okay, regulators do not operate a hand-holding function, but IRDA as a developmental regulator has a standard practice of monitoring products. So like Ayush, it will monitor the Ayush scope of policies. It will look at service levels impediments. It will look at the generation of grievances. It will look at the take-up of Ayush coverages via claims analysis. And it will keep monitoring. So that's standard practice. So I think the industry is in good hands.
Amit, I want to come to you with a question. Since you also communicate and interact with policyholders directly in that sense, how are you looking at different ways to tell policyholders, to sensitize them that this is something that they should be looking at? If it is their preferred way of treatment, it can be covered under insurance. Here are the full benefits. How do you tell them and reach out to them with that ultimate message?
So it's quite a dichotomy, if you look at Ayush and health insurance right now. See, historically, most of the Ayush treatments have been OPD, outpatient, So like I remember my first or only stint with Ayush has been my mom taking me to a homeopathic doctor, for a fever or a minor ailment. You get those medicines, you take them over a period of time and you recover.
Correct.
They are considered to be extremely safe. People trust that a lot. But largely, what we have seen is that Ayush treatments are outpatient in nature. Most of the voluntary health insurance in India historically has not really covered for outpatient. They've all been inpatient treatments where people have bought health insurance.
Correct.
From the purpose of, covering for cancer and heart attack and knee replacements and cataract and so on and so forth. So I think that is one big sort of gap, I would say, between where Ayush coverage is and where consumers think Ayush coverage is. I think that is one gap. The other issue is, how do you provide cashless inpatient Ayush treatment? That's the other thing, because consumers of health insurance typically prefer a system where you get cashless health insurance. So I think that's the other sort of issue to solve, because if I am a consumer and I'm buying health insurance and I want let's say inpatient Ayush treatment, I would expect cashless coverage. I would not want to pay from my own pocket and then go into a process of reimbursement. So So these are the couple of things that we really focus on when we talk to our consumers. One, we're trying to sensitize people that outpatient coverage can also be bought when you buy a health insurance policy, because that would mean that your trip to a homeopathic doctor or to a yoga center or stuff like that can also be covered, because that's the more likely expense that might happen.
Correct.
And second thing is, in case there is an inpatient treatment required, then that can be done in a cashless manner as well.
Okay, makes sense absolutely to what you're saying. Mayank, just to carry that question forward, with respect to it incorporating itself in existing insurance policies as well, is today one big problem of sort of understanding the data and pricing these products accordingly?
See, firstly, I think we must understand that it's an alternate treatment. It's not that you're doing allopathy also and you're doing Ayush also. I mean, so therefore you are either going for Ayush at a particular point of time, or you're going for the tradition, the currently covered, let's say allopathic treatment. So that's not the big concern that, will I be charged more because Ayush is covered? That should not be concern in the mind of the consumer, because some people will go for one, the other one will go for the other treatment. For Ayush, I think we'll have to work together with the concerned stakeholders, people like Siddharth and the ministry and other stakeholders in the Ayush treatment, in terms of what should we use as data to price our products for, what could be the incidence rate, what should each treatment type cost us in different categories of, let's say, treatment facilities, etc. And I think that work is on. As we interact more, over somewhere we have to make a beginning. Just because we don't have data, we can't say, hey, we can't price it and offer it. Fact is, we are offering it now. So as we start getting more and more consumers using these services, I think we'll start gathering data.
Correct. Mr. Devasya, to come to you with an important point that, the Ministry of Ayush also said in a very recent meeting. They said that the Ayush treatment should be based on transparency, standardization and scientific approach. These were the three important pillars that they spelled out as far as the treatments and the insurance coverage is concerned. I want to speak to you about one of these 3 points, and that is standardization. From the regulator's point of view, how should the regulators sit with the industry, and what should be the parameters for standardization of treatment costs going ahead, which will help the insurance companies also to identify the claims in the right way?
My personal view is that it's not within the regulatory ambit to actually go and supervise standardizations of things that are not in its domain. So my view is this: if you look up the work that is done by the Ministry of Ayush, which incidentally I think in late 2023 or 22 had also set up a committee on core experts for insurance. And the industry has coordinated with that. Okay, so the work that is done there is basically to actually mirror the clinical data standards of conventional medicine, allopathic or English or Western, okay, and bring in that same organization into the entire, set of Ayush, forms of treatment.
Correct.
Okay, and I believe that there's substantial work done there. They've also gone into standardization, creation of awareness. They've also, looked at the Drugs and Cosmetics Act, okay, to ensure that quality standards of Ayurvedic products and services, or Ayush products and services, are also available and visible.
On that note, we have to take a very, very short break. Lots more as far as Ayush treatments and the concept of insurance is concerned on the other side of this short break.
CNBC TV 80, The Policy Bazaar Insurance Show.
Welcome back to this special insurance series, the Policy Bazaar Insurance Show. And today's discussion is on a very, very new concept, which is Ayush treatments and how these treatments for you can be covered through the right insurance policy. Siddharth, to start this second part of the discussion with you, for you also, I mean, just from the point of view of commercial sense also, it is important to be, tied up with insurance companies so that, people coming to the wellness center for treatments also get that advantage. Is it difficult today to sort of go out and make these tie-ups with insurance companies? what are the problems that you're facing, and how, according to you, what would you require from insurance companies to have, expand your network in terms of the coverage here?
As an operator, the kind of issues what we've been hearing from patients who come to us has been the difficulty in processing insurance in case of an Ayush product. And I think the difficulty comes from there is no standardization. The lens used to look at Ayush offerings is very similar to those used for allopathic treatments. Whereas this whole process has to be looked at with a different lens. So I think this conversation is something, and there needs to be a lot of regularization that has to happen. There are people who are not accredited. How do they look at, what kind of lens do they use for that? I think it's a big subject which Ayush is
Opening it up for different, correct. Yes. Makes sense, absolutely. Amit, to come to you, today insurance is being looked at as a tool to cover large, big-sized healthcare expenses. Even today, with facilities like OPD as well as outpatient treatment, insurance numbers tell you is not used that extensively, because a lot of people have this idea that if I tend to use my insurance policy, it does take away certain benefits that could be in the form of no claim bonus in the following year. Ayush treatments, though on one side they're not very well understood, but also thought of as treatments which would not require any significant cost, and I can shell out that money out of my own pocket rather than using the insurance policy. How do you look at this entire dichotomy, the dynamics of using an insurance policy for an Ayush treatment that you want to have?
So yes, actually the dichotomy is actually getting a bit better, I would say, in the last couple of years. A lot of innovation has happened in products, and I'll give you some examples. So one, a lot of policies now come with what is called a claim protector kind of a benefit, or an NCB protector benefit. What it means is that if your claim is a small claim, so let's say you have a policy of 10 lakh rupees, sum insured, and you claim less than 1 lakh rupees, then your no claim bonus is not impacted. So that is a benefit which protects your no claim bonus. That's one. Secondly, a lot of policies now come with actually what is called cumulative bonus and not no claim bonus. So that basically rewards you for being with the insurance company and not really linking it with your claim behavior. So a couple of these innovations have come in, and that they've sort of dealing claim and your policy benefits as such. That's part one. See, at the end of the day, a consumer is buying a health insurance policy to claim. If you disincentivize too much, then somewhere there's a conflict. That's one. Second thing is specific to Ayush. Again, I think as this develops, I think, and as I would say health insurance integrates more with Ayush, you'll probably start to see a lot of savings coming from people who claim for Ayush treatments rather than the traditional allopathic treatments. See, what's happening is hospitalization is becoming more and more expensive. Modern treatments are coming in, robotic surgeries are coming in. The cost of a regular hospitalization is becoming expensive and expensive. As consumers use more of Ayush rather than as an alternative rather than going for the regular hospitalization, I think the insurance companies will start to see a lot of benefit in terms of the costing that happens to them. And I think as we start to see a benefit, automatically that benefit will get passed on to the consumer as well. So I would say probably in a few years down the line, insurance companies may say that if you opt for an Ayush treatment rather than a regular hospitalization, I will give you a certain benefit. So like I'll give you another example which is real right now. A lot of companies say that if you go to the hospital, I recommend, or if you opt for home hospitalization or treatment at home, rather than going to a hospital, they give you a hospi-cash benefit. Correct. So you get some 5,000 rupees a day if you opt for hospitalization at home.
Of the insurer's choice or at home. No, that will be very important. I think the point that you make to encourage these treatments through giving incentives to policyholder. But since we have two stakeholders of this entire, Ayush and insurance dynamics, Siddharth, to start with you, today, as you see people coming to your wellness center itself, as a general trend, how many of them come for treatments, curative treatments, and how many of them come either for recreational purposes or relaxation or other things that Ayush treatments do help?
Last 20 years of our operation, we have seen we started off in the space you defined as rejuvenative slash wellness. But now 95% come for curative. So that's the big shift. People are coming for very, very serious health issues and concerns. They don't see the solution modern medicine can give. They think traditional and Ayush treatments can provide answers to their conditions.
Mayank, just one question before we conclude this discussion. In your sense, from the insurer's point of view, what could be the kind of benefits that you are looking at in terms of co-pay, in terms of room rent, or any innovative ways in which you look to incentivize people to take up this treatment?
I would say that, if we are practical, I think we're a little bit away from that situation, Yash, because I think first we have to get people to be aware of this. We'll have to solve the problem of what's a network, what's a paper. I think we'll have to first solve that problem rather than I don't think so today we are necessarily reached that conclusion.
Correct.
At some stage with enough data, maybe that can happen. The benefits can be in various forms. It could be in copay, it could be some additional benefits in terms of increase of your sum assured, like it happens in others. It could be some other benefit like Hospicash or some other healthcare services benefits, etc. I don't know what shape and form it will take in the future, because I think it's a little bit futuristic for now.
Mr. Devasya, to come to you with the concluding question, what according to you would be some of the low-hanging fruits which the insurance industry should aim for immediately to clear out and make the foundation for a very easy claims process and treatment process?
We do not understand that Ayush is actually something that goes to the credit of health insurers who are laboring under paying up for conventional medicine treatments. Let me pull a very close comparison. The same underwriting broadly is the same concept. But if I pick up property or infrastructure or construction risk insurance, the very insurer, the very underwriter is giving a whole lot of incentives, like you risk-proof your property, I will give you premium credit.
Correct.
Okay. You do loss prevention, I will give you credit. And let's say the loss occurs, you have instruments for loss control, I will give you credit. What is Ayush? Ayush is nothing but adapting your lifestyle into something called healthy lifestyle. I don't want to wait, let's say, 5 years down the line. I feel that IRDA should intervene and put a stop on this and understand that insurance needs to be delivered and enforce that just as they enforced Ayush.
Valid point. Thank you so much, gentlemen, for this discussion. With that, we've come to an end on this very special edition of the Policy Bazaar Insurance Show. We'll come back soon. We'll return soon with another interesting theme, another interesting episode. Till then, stay safe, stay insured.
CNBC TV 80, the Policy Bazaar Insurance Show.
Presented by Policy Bazaar.